COVID is here. A little strand of RNA that used to live in bats has a new host, and that strand is clearly not the flu. New York is overrun with more than half the nation's new cases per day, and refrigerated 18-wheelers parked outside hospitals serving as makeshift morgues. Detroit, New Orleans, Miami, and Philadelphia await an inevitable surge of their own with bated breath. America's healthcare workers are scrambling to hold the line against a deluge of sick patients, arriving hourly at a rate that's hard to fathom. I pause here to attest to the heroic response of the medical community and the countless more working to support them. At the time of this writing, despite 368,000 confirmed cases in the United States, 11,000 deaths have been reported. This is a horrid number, but still a far cry from Italy with 130,000 cases and 16,500 deaths, and Spain with 14,000 deaths amidst 140,000 cases. Italy and Spain may be a few weeks ahead of the United States, but at the moment, Italy and Spain have case fatality rates that are multiples of the United States. If this rate does stand, it'll be a testament to the tenacity of medical workers toiling under extenuating circumstances. With the scale of the tragedy now obvious, the take from some very smart people is that the people who should have been paying attention were asleep at the wheel. The easy target is the bombastic New York real estate developer and current president of the United States who repeatedly assured raucous campaign crowds in the nation that the virus was under control before it wasn't. The charge is made that the president ignored warnings and painted a rosy picture of an unfolding crisis in a short-sighted attempt to preserve the economy and a beloved stock market. He may be guilty of the latter charge, but the real question relates to ignored warnings. Where were the warnings? Who was sounding alarm that was ultimately ignored? It was late in December that multiple doctors in China first learned of a cluster of cases of pneumonia related to a seafood market in Wuhan. News circulated via physician WeChat groups of a new pneumonia with entreaties to family members to wear masks and avoid the market. Shortly after, a Chinese lab in Shanghai isolated and sequenced a then unknown virus on January 5th, a full 2 days prior to China's official announcement that mysterious pneumonia cases in Wuhan were caused by a novel coronavirus. Recognizing the importance of the findings, the researchers reported results to China's National Health Commission the same day. After 6 days without a response, the Shanghai lab made its findings public in January 11th and released its data on open access data repositories for the world to see. It was only then that the Chinese National Health Commission announced it would release the genome of the virus to the WHO. The following day, the Shanghai lab found itself shut down for rectification. The ill patient the samples had been derived from had been admitted to Wuhan Hospital December 26th. As an ever-increasing number of patients swarmed local hospitals, no evidence of larger public health measures to mitigate the virus were evident. A Lunar Year banquet scheduled in Wuhan proceeded as planned January 18th, and 40,000 families gathered to share home-cooked food on January 1st alone. It was not until January 20th that the lead physician in China in charge of the virus response confirmed that human-to-human transmission was possible. By then, local Wuhan hospitals were being flooded with patients and the virus was popping up all over China. Scrambling to contain a situation spiraling out of control, China imposed a lockdown of 60 million people in Hubei province January 23rd. Tragically, one of the first physicians to signal alarm at the turn of the new year, ophthalmologist Li Wenliang, was infected with the virus and was fighting for his life. He died shortly after. The unprecedented actions taken by China should have been a signal to the WHO and the rest of the world that everything was most definitely not okay. The WHO actually did convene January 30th to declare a public health emergency of international concern, but the public comments were focused on signaling to the world that China had the situation under control, that the announcement was not caused to institute travel or trade restrictions with China, and that the declaration was only being made out of concern for the health systems of developing countries the virus may spread to.
The Chinese government is to be congratulated for the extraordinary measures it has taken to contain the outbreak, despite the severe social and economic impact those measures are having on the Chinese people. We would have seen many more cases outside China by now, and probably does, if it were not for the government's efforts and the progress they have made to protect their own people and the people of the world.
Repeatedly and predictably, the WHO steadfastly recommended against travel restrictions at every point of the crisis.
Meaning, if anyone is thinking about taking measures, it's going to be wrong. And WHO doesn't recommend and actually opposes any restrictions for travel and trade or other measures against China.
It's possible that a clearer picture of what was actually going on in China with respect to the caseloads and deaths was needed for anyone to decide anything. but I'm not sure what information the brain trust of the WHO would have needed to say anything different. The position of the WHO with respect to travel did not change a whit, according to a tweet sent on January 10th, before there was known human-to-human transmission, another sent January 30th, after declaring an international public health emergency, after 60 million people had been quarantined in China, and the first U.S. case report of a traveler from China sick with the virus had been reported. As late as February 4th, the WHO continued to express confidence that 99% of cases reported were in China and persisted in advising against travel restrictions. Over and over again, the world's health police, whose main function is to alert the globe to impending epidemics, repeatedly violated basic common sense when dealing with imperfect information. In the face of a novel pathogen where the mode of transmission, the ease of transmissibility, and the lethality of the virus was unknown, the WHO chose to stick its head in the sand. The black comedy in all of this is that the WHO seemed much more focused and concerned at the time with disinformation surrounding the impending pandemic. The organization that repeatedly opposed travel restrictions also opposed the widespread use of masks as late as March 3rd.
It's not necessary to wear a mask. I'm sure many of you will be interested in that. The mask is really mostly helpful for people who are already coughing because it protects other people from the results of that cough. Most of the masks that are out there right now, the thin surgical masks, they don't really protect directly, and it may be that we are using too many masks because who really needs the mask is the health workers, the nurses and doctors who are treating people in hospital. So we recommend that you use a mask if you're already sick or if you're looking after someone who's sick. But otherwise, we're not recommending masks in a general sense.
They also repeatedly and obsequiously asked people around the world to go about their daily business because China had everything under control.
This declaration is not a vote of no confidence in China. On the contrary, WHO continues to have confidence in China's capacity to control the outbreak. But not only what they're doing is protecting their people, but I know from the figures also, you know that it's protecting the rest of the world. Outside China, we only have 98 cases and no deaths. If strong measures were not taken in China, this would not happen.
The unfortunate fact was that the credibility the wider world gives to the WHO made them one of the chief sources of disinformation as the pandemic unfolded. It is no accident that local health officials and doctors paired the WHO talking points. Local officials didn't spend much time thinking of viral pathogens that can turn into pandemics on a daily basis. They rely on institutions like the CDC and the WHO that are supposed to have public health experts focused on threat assessment. Little do they know that the WHO based their risk assessment on what China was telling them. We now know without a doubt that the numbers out of Italy and New York point to an outbreak in China that was orders of magnitude greater than what was officially stated or known. The reality was that China had bungled the response badly. Clearly the people on the ground felt a sense of urgency when a potentially novel SARS-like virus was identified, but they were let down by bureaucracy that was lethally slow. When it was clear the extent of the outbreak couldn't be hidden any longer, the Chinese Communist Party quickly moved to preserve itself by launching a public relations campaign, framing the story as an unprecedented crisis, turning the narrative into lives saved in China and the world because of the bold actions of the CCP. The WHO, constantly concerned with appeasement of China, was a willing cheerleader.
That's why I also said we have to appreciate what China is doing. And this declaration is not actually because China is not doing what it can. It's actually doing more than China is required to do.
The multi-billion-dollar budget of the WHO translates to interminable meetings, meaningless declarations of emergencies, and many tweets of the importance of hand washing. At no point did they lead the response, leaving countries big and small to figure it out on their own. Small countries like South Korea, Singapore, and Taiwan had an infrastructure and urgency driven by the prior brush with the SARS epidemic and started widespread testing, as well as aggressive contact tracing and isolation of positive contacts. The WHO frequently mentions the success of South Korea and amplifies Korea's test everyone strategy, but leaves out the fact South Korea banned travel from Hubei province in early February. Another success story is Taiwan. Taiwan is not recognized by the WHO out of deference to China. Not surprisingly, Taiwan began to screen passengers from China December 31st, banned Wuhan travelers January 23rd, suspended tours from China January 25th, and restricted all Chinese visitors February the 6th. Perhaps Taiwan's exclusion from the WHO is a good thing. It didn't wait to take its cue from the organization that didn't label the worldwide explosion a pandemic until March 11th. Comically, and in keeping with their prime directive to reassure, they immediately followed the announcement of a pandemic by saying, describing the situation as a pandemic does not change the WHO's assessment of the threat posed by this coronavirus. It doesn't change what WHO is doing, and it doesn't change what countries should do. The major problem here is that the masses of local health officials in countries take their guidance from the soothing evidence-based proclamations of the WHO. This is why, in the midst of a pandemic, school officials are worried about free lunch programs and adequate home internet access, while progressive politicians are rushing to local Chinatowns to have photo ops to discuss stigma and xenophobia.
The risk to New Yorkers for coronavirus is low, and that our preparedness as a city is very high. There is no reason not to take the subway, not to take the bus, not to go out to your favorite restaurant, and certainly not to miss the parade next Sunday. I'm going to be there.
It becomes a little harder to get angry at Donald Trump for reassuring his fans everything was going to be just fine when the WHO was saying the same thing. What warning exactly was the president ignoring? Recall that it took the WHO until March 11th to even declare a pandemic. This might be why Bill de Blasio, the New York City mayor, who eventually would be presiding over 8,000 new cases of COVID a day, would say this on March 2nd.
You're under 50 and you're healthy, which is most New Yorkers. There's very little threat here. This disease, even if you were to get it, basically acts like a common cold or flu. Because people's livelihoods are at stake, parents need a place for their kids. We can stay safe, but still keep our lives going, our economy going. People have to pay the rent. People need money for food, etc. We cannot shut down because of undue fear. That's my concern.
It may be the case that this pandemic was unavoidable. The lessons learned here have been very hard ones with tragic costs. The usual culprits are easy to see. The need to scale up rapid testing, improved contact tracing, local supply chains that allow rapid scaling up of essential medical needs, among many others. But the more important lesson here is to break the institutional groupthink that dulled our senses. It was late December when Chinese physicians warned their family members of a potentially new dangerous disease. It was January 5th that a local Chinese lab identified and sequenced the genome for a new coronavirus. Faced with a lack of evidence of a new virus, the WHO began to blindly reassure almost everyone immediately after and persisted down this road until it was too late. It's clear that this is a plan that worked until now because the viruses that have emerged until now are simply not as infectious as COVID. The fervent hope here is that the health system bends but does not break with the test it has been given. Reasons for optimism abound as the medical community and the nation exert a massive effort to overcome this public health crisis. The failure of the responsible institutions will hopefully not fade from memory anytime soon. If we are to avoid the next pandemic, it will be because we listen to those at the coalface and ignore the empty suits from Geneva and their even emptier proclamations.